Welcome to the Clear Gun Show. I'm your host, Dr. G, with a PhD. Before we get started, remember guys, tell your friends about this show, and please like and subscribe on this episode. It really helps with the YouTube algorithms. If you like the thumbnail art, you can check it out on a much higher resolution on Instagram. And remember, leave any questions you might have throughout the week. And on the last episode of the week, I will be answering the questions in a mailbag. All right, so we've got an exciting episode for you guys today. We're going to be talking about a lot of other countries: Australia, Israel, Austria, France, Ireland, UK. We're going to touch on all those guys. We're going to talk about the NFL's new COVID policy. We're going to talk about a judge in Texas halting the federal vaccine mandate for employees. Then we'll be breaking down a MMWR, a morbidity mortality weekly report from the CDC that we discussed last week, and it's got some really great news for those of you that have had COVID and made it through. And finally, we get to some mailbag. Let's dive on in. Well, we find ourselves once again with Australia. Let's watch this quick video.
So far, the science shows that people with only 2 doses of a COVID vaccine have only a 4% protection against being infected by the Omicron variant, just 4%. With a 3rd dose, it can provide a 64% protection against infection.
So with 2 doses, it's 4% at preventing infection, and with 3, it's 64%. So the problem with all of this is when you only listen to, as he calls it, the science, and you don't do any prudential judgment. How exactly is this convincing to someone that's unvaccinated? So what they're saying is, look, if you get 2 doses of the vaccine, it doesn't really work at preventing Omicron, but get this 3rd dose and it will prevent you from getting Omicron. So if you're unvaccinated, the difference between you and a vaccinated person is 4% and getting it. And the difference between you and a triple vaccinated person is 64%. But then you look at the disease and then you look at Omicron and you say, wait a minute, this variant has a vast reduction in hospitalizations. So now if you're a government and your whole plan was just vaccination, you're in a really tricky spot. We showed it last week, but even the CEO of Pfizer says, look, the Omicron is just outside the scope of this particular vaccine. And remember, this vaccine is for the original variant. Okay, so I think these countries are going to be in a real bind here trying to convince their populations, A, the ones that aren't vaccinated to start getting vaccinated, and B, the ones that are vaccinated to continue getting boosters. In light of the data of just Omicron as a virus in and of itself and its hospitalization rate being quite low, and the effectiveness of these vaccines, they're becoming less and less effective, obviously, as new variants come out. So with this dilemma in mind, let's go take a look at Israel, which is one of the most vaccinated countries against coronavirus in the world. This is from the Jerusalem Post. COVID-19, almost 70,000 new cases. Defense Minister Gantz tests positive. There are currently 453,505 active coronavirus cases in Israel, 99.8% of which are classified as mild. A total of 69,104 COVID cases were recorded in Israel on Thursday. The health ministry reported on Friday morning with 638 people in serious condition, 123 of whom are on ventilators. Of those currently hospitalized in serious condition, 84% are over the age of 60, and 1% are between the ages of 0 and 4. The remainder of serious hospitalization patients are 19 to 59. There are currently 453,505 active coronavirus cases in Israel, 452,692 of which are classified as mild, and a total of 219,646 people are currently self-isolating at home. As of Friday, 55% of serious cases are in patients who have received 3 vaccines, and 24% have not received the vaccine at all. On Friday morning, Defense Minister Benny Gantz announced that he had tested positive for COVID-19 after taking a PCR test. So again, if you're an unvaccinated person and you're just following the data, it's getting harder and harder, I think, to be convinced just by the numbers to get vaccinated, at least with the current vaccine. Maybe if a new vaccine comes out and these variants change and a lot of other factors change, you might be more compelled to. But just on the data alone, it's getting harder and harder to convince, in my opinion, unvaccinated people to get vaccinated. Despite this data that keeps coming out, and we're going to break down a story that I mentioned on Thursday, just because it's very interesting in terms of COVID and vaccination. Before that, let's take a look at some countries that, despite this evidence, despite the new numbers coming out, are doubling down on vaccine mandates. So first, we'll start with Austria. The Austrian parliament approves a vaccine mandate for all adults. The Austria's parliament has voted to introduce COVID-19 vaccine mandates for adults from February 1st, the first of its kind in Europe. This was reported on January 20th, 2022 from ABC. Austria's parliament voted Thursday to introduce a COVID-19 vaccine mandate for adults from February 1st, the first of its kind in Europe, with maximum potential fines up to €3,600, which is $4,000 American dollars, for people who don't comply after a series of reminders. Lawmakers voted 137 to 33 in favor of the measure, which will apply to all residents of Austria aged 18 and over. Exemptions are made for pregnant women, people who for medical reasons can't be vaccinated, or who have recovered from the coronavirus in the previous 6 months. Officials say the mandate is necessary because vaccination rates remain too low in the small Alpine country. They say it will ensure that Austria's hospitals are not overwhelmed with COVID-19 patients. Health Minister Wolfgang Muckstein, speaking in Parliament Thursday afternoon, called the measure a big and for the first time also lasting step in Austria's fight against the pandemic. He said, "This is how we can manage to escape the cycle of opening and closing of lockdowns," noting that it's about fighting not just Omicron, but any future variants that might emerge. He said again, "That is why this law is so urgently needed right now." The article continues. The measure passed easily in Parliament after a fierce debate. Chancellor Karl Nehammer's governing coalition, made up of his conservative Austrian People's Party and the Greens, worked with two of the three opposition parties in Parliament on the plan. The far-right Freedom Party vehemently opposed it. Quote, "I am appalled, I am stunned, I'm shaken, and I'm shocked," said Freedom Party leader Herbert Kickl, calling the law nothing more than a huge blow to the freedom of Austrians. The term far-right gets thrown around a lot. I have no idea what it means in regards to Austria. Is their far-right like America's left, or is it like America's right? It's hard to tell because each country is so different. But I think I'm agreeing with Herbert here. And I really think that Austria is going to see a hard time actually enforcing this. And I think that their citizens are going to be pretty upset, and there's going to be a pretty good amount of demonstrations coming here in the near future. Also interesting that in this statement, Austria is making an exemption for pregnant women, whereas here in the U.S., pregnant women have been they've been told by even up to the CDC director that this shot is safe for them and that they should do it. I wonder why there's an exemption in Austria for this. We'll see. I don't know. Just commenting. Now let's take a look at France. This comes from France 24. French Parliament approves more restrictive vaccine pass. This was written on January 16th of 2022. France's parliament gave a final approval on Sunday to the government's latest measure to tackle the COVID-19 virus, including a vaccine pass contested by anti-vaccine protesters. Lawmakers in the lower house of parliament voted 215 in favor to 58 against, paving the way for the law to enter force in the coming days. The new law, which had a rough ride through parliament, with opposition parties finding some of its provisions too tough, will require people to have a certificate of vaccination to enter public places like restaurants, cafes, cinemas, and long-distance trains. Currently, unvaccinated people can't enter such places with the results of a recent negative COVID-19 test. Nearly 78% of the population is fully vaccinated, according to the health ministry. President Emmanuel Macron, who is expected to seek a second term in April's presidential election, told Le Parisien paper this month that he wanted to piss off the unvaccinated people by making their lives so complicated they would end up getting the COVID vaccine. We reported on this earlier in the month. Thousands of anti-vaccine protesters demonstrated in Paris and some other cities on Saturday against the law, but their numbers were down sharply from the week before, just after Macron's remarks. France is in the grips of its fifth COVID-19 wave, with daily new cases regularly hitting record levels of over 300,000. Nonetheless, the numbers of serious cases putting people in ICU wards is much lower than the first wave in March and April of 2020. While some places are doubling down, other places are turning around. Let's go to Ireland. This is from Reuters. Ireland drops most COVID restrictions in wake of the Omicron storm. Ireland is to scrap almost all of its COVID-19 restrictions on Saturday after coming through the storm of the Omicron variant that led to a massive surge in infections, Prime Minister Michael Martin said in a national address. "We have weathered the Omicron storm," Martin said in a Friday televised address, in which he said booster vaccines had utterly transformed the situation in the country. "I have stood here and spoken to you on some very dark days, but today is a good day," he said. The country has been one of the most cautious in the European Union on the risk of COVID-19, putting in place some of the longest running restrictions on travel and hospitality. But following advice from public health officials, the government decided that bars and restaurants will no longer need to close at 8 p.m., a restriction put in place late last year when the Omicron wave struck, or to ask customers for proof of vaccination. Now, we commented on the 8 p.m. thing when it came out, and it was just, what a silly rule. It made no sense. Like, the virus just started working at 8 or started infecting people. It's just kind of weird. Indoor and outdoor venues are also set to return to full capacity, paving the way for full crowds at next month's Six Nations Rugby Championship. People will still be required to wear masks on public transport and in shops until the end of February, Martin said. Ireland's hospitality sector, which has been particularly hard hit by one of Europe's toughest lockdown regimes, welcomed this decision. The excitement is palpable, Dublin restaurant Las Tapas de Lola said in a Twitter post in which it said it had seen a surge in bookings in anticipation of the new rules. Ireland is not alone, as we know. England has another measure coming down the pike that is a great news for everyone that is reasonable about vaccines. And this article comes from iNews, and it's a UK branch. The COVID vaccine mandate for NHS staff could be paused by government over fears that 70,000 workers would be sacked. Boris Johnson is under pressure from MPs who fear the April 1 deadline could do more harm than good. Fears of the mass sacking of more than 70,000 NHS workers have prompted the government to consider pausing its plan for compulsory vaccination for health services staff. A temporary suspension of the controversial policy is being actively looked at within the Department of Health and Social Care, amid dire warnings from hospital trusts and GPs of the severe impact of staff shortage on services, sources said. All staff in patient-facing roles are currently required to have 2 jabs from April 1st or face dismissal. The need for a gap between doses means that anyone who doesn't get their first dose by February 3rd will be told they will be losing their job, with little chance of redeployment. With several Tory MPs vigorously opposed to the compulsory vaccination plan for NHS staff, not least because of the impact a staffing crisis will have on their local hospitals, a pause would also help Boris Johnson in his battle to avoid a confidence vote by his own party. Pressure on the PM and Health Secretary to halt the mandatory jabs program has intensified in the past week amid new internal Whitehall documents suggesting 2 jabs would not be enough to cope with the Omicron variant. Analysis of NHS's England figures show 80,092 NHS workers have not had a single dose of the COVID vaccine, and a government impact assessment has warned 73,000 patient-facing workers are unjabbed. Those who are medically exempt will be able to keep their jobs. The Royal College of Nursing has warned that it will be an act of self-sabotage at a time when the NHS is suffering from staff shortfalls. One London trust alone warned it could have to fire 1,600 staff, and several trusts across the country are understood to have asked NHS England to urge the DHSC to rethink. One government source said its line remained unchanged, adding, "We are cracking on with the policy." The pressure is mounting, and I think it's going to end up that it is the case that they do not mandate vaccines for their NHS workers. We'll see what happens in the coming months. I hope that that is the case. Moving over to the US, we got 2 stories before we break down that CDC MMWR. The first story, NFL issues memos to stop daily COVID-19 testing for unvaccinated players. This is from Sports Illustrated. The NFL and the NFL Players Association agreed to cease daily COVID-19 tests for unvaccinated players, allowing them to follow the protocols that were issued for vaccinated players and coaches in December. The league sent a memo to the remaining 8 teams in the NFL playoffs on Friday, eliminating the designation between unvaccinated and vaccinated players. Amazing how the science changed from December to January. Truly amazing. The NFL's change comes after the number of cases of the Omicron variant. All players and tiered staff will undergo enhanced symptom screening, symptom-based testing, and targeted surveillance testing. According to the NFL's most recent COVID-19 data from January 13th, 95% of players and nearly 100% of staff members are vaccinated. Of all the unvaccinated players remaining on playoff teams, only about a dozen haven't had COVID-19 already, according to Pellicero. So the latest change will only affect a small number of people. Fantastic seeing acquired immunity become more and more mainstream. It is about darn time. In our final story, Judge Brown out of Texas decides to block Biden's vaccine mandate for federal workers nationwide. Let's read the opening paragraphs of this decision. This is the United States District Court for the Southern District of Texas, Galveston Division, and it's the Feds for Medical Freedom et al. Plaintiffs and Joseph R. Biden Jr. et al. Other defendants. Now, the plaintiff have moved the court to preliminarily enjoin the enforcement of 2 executive orders by the president. The first executive order, 14042, is already the subject of a nationwide injunction because that injunction protects the plaintiffs from imminent harm. The court declines to enjoin the first order. The second executive order, 14043, amounts to a presidential mandate that all federal employees consent to vaccination against COVID-19 or lose their jobs. Because the president's authority is not that broad, the court will enjoin the second order's enforcement. The court notes that at the outset that this case is not about whether folks should get vaccinated against COVID-19. The court believes they should. It is not even about the federal government's power exercised properly to mandate vaccination of its employees. It is instead about whether the president can, with the stroke of a pen and without the input of Congress, require millions of federal employees to undergo a medical procedure as a condition of their employment. That, under the current state of the law, as just recently expressed by the Supreme Court, is a bridge too far. This is great stuff. And if you don't think this is coming to the CMS mandate, you've got another thing coming. I think this is going to be happening quite soon. And my main reason for thinking this is that reality always wins. No matter how much you want to run away from it or dodge it or escape it, the reality of situations always come out on top. And the reality of COVID situation is that this vaccine hasn't managed infection or spread the disease. And so if that's the main impetus for vaccinating these employees, well, just the numbers don't pan out. And so just on the evidence alone, the mandate fails. But also, like this judge said, the Supreme Court's decision throws the other decision for CMS into wild controversy. And I think it's going to come out that hospitals that work with CMS are not going to be forced to vaccinate their employees from the federal government. Now for our last story before mailbag, we're going to break down the CDC's MMWR, which is the Morbidity and Mortality Weekly Report. And this came out January 19th. We mentioned it on Thursday, but I'm just going to go over some of the numbers with you guys to make the picture a little more clear. The title of this MMWR is COVID-19 Cases and Hospitalizations by COVID-19 Vaccination Status and Previous COVID-19 Diagnosis, California and New York, May to November of 2021. The MMWR opens up by saying, by November 30th, 2021, approximately 130,781 COVID-19 associated deaths, 1 in 6 of all U.S. deaths from COVID-19, had occurred in California and New York. One quick note, the vernacular has changed slightly. If you notice, they said the words associated death instead of with or from and COVID. So I expect to see this a lot more from here on out. So who was in this study? They had 4 cohorts of adults that were 18 years or older, and they were either 1, unvaccinated with no previous laboratory confirmed COVID-19 diagnosis, vaccinated 14 days after completion of a primary COVID-19 vaccination series with no previous COVID diagnosis, unvaccinated with a previous COVID diagnosis, and vaccinated with a previous COVID-19 diagnosis. The MMWR goes on, COVID-19 incidence in both states was the highest among unvaccinated people without a previous COVID-19 diagnosis compared with that among the other 3 groups. So during the week beginning May 30th, 2021, compared with COVID-19 case rates among unvaccinated persons without a previous COVID-19 diagnosis, COVID-19 case rates were 19.9-fold in California and 18.4-fold in New York lower among vaccinated persons without a previous diagnosis, 7.2-fold in California and 9.9-fold lower in New York among unvaccinated persons with a previous COVID-19 diagnosis, and 9.6 in California and 8.5-fold lower in New York among vaccinated persons with a previous COVID-19 diagnosis. Moving to October 3rd, after Delta or during Delta, the numbers changed pretty dramatically. So COVID-19 diagnosis case rates among vaccinated persons without a previous COVID-19 diagnosis were 6.2-fold in California and 4.5-fold in New York lower. Rates were substantially lower among both groups with previous COVID-19 diagnoses, including a 29-fold in California and a 14.7-fold lower in New York among unvaccinated persons with a previous diagnosis, and 32.5-fold in California and 19.8-fold in New York among vaccinated persons with a previous diagnosis of COVID-19. So here's the real kicker. Here is just the crux of the argument, and I don't know why we're not hearing this being shouted from every rooftop by every CDC official and NIH official and every government official. Here's the statement. These results demonstrate that vaccination protects against COVID-19 and related hospitalization, and that surviving a previous infection protects against a reinfection and related hospitalization. Importantly, infection-derived protection was higher after the Delta variant became prominent, a time when vaccine-induced immunity for many persons declined because of immune evasion. And here's a chart, here's a figure in the MMWR, and the title of the figure is Incident Laboratory Confirmed COVID-19 Associated Hospitalizations Among Immunologic Cohorts Defined by Vaccination and Previous Diagnosis History is in California. So if you look at the legend, the solid blue line, which has the mountain that you see there, are unvaccinated with no previous COVID-19 diagnosis. Then the other 3 lines, yes, there are 3 lines there, although it's hard to tell. One is vaccinated with no previous COVID-19 diagnosis, one is unvaccinated with previous COVID-19 diagnosis, and one is vaccinated and previous COVID-19 diagnosis. All 3 of those drag along the bottom, so there's really very little difference. So let's see if this finally allows people to discuss natural immunity or acquired immunity without being silenced by others, especially for not following the quote-unquote science. That was such a terrible way to silence people, for questioning history, like years and decades, all of medical knowledge. where we know that in a lot of cases, once you have the infection and you've built immunity to it, you're good. Why that was just out of the discussion for over a year is insane to me. Hopefully this brings it back finally. Now it's time for mailbag. I have got to start working on an intro for mailbag, a little 5-10 second clip thing. I'll be doing it the next couple weeks, but let's get to the questions. All right, so first of all, from the professor, again, hello professor. Why is ivermectin being labeled as horse paste when it obviously has human medical uses? Those uses aside, it's so weird to me that there are so many negative ivermectin narratives when it's been around for a long time. So this is a tough question because no one knows the real answer. And my intuition is it's a combination of a few things. So one, you've got Pfizer. Now Pfizer has had a very sketchy past. That's not to say they don't produce great drugs as well. They just also have a sketchy past. And Paxlovid, their new drug, is a ritonavir, which is a protease inhibitor, combined with an experimental drug, and that's meant to attack COVID. And ivermectin is a protease inhibitor as well. And so people are saying, well, Pfizer's trying to make a bunch of money on this new drug by pooping on ivermectin and selling the new drug. Now, it is true they're trying to make a bunch of money. The two drugs are different. Ivermectin is just a protease inhibitor. This new drug, Paxlovid, has other things mixed in to try and make it more effective and reach concentrations that are useful for COVID. That being said, we know a bunch about ivermectin. We have a great safety profile for this drug. It's been around for forever. We know next to nothing in terms of safety for Paxlovid. It's still quite experimental, which is why they're requesting emergency use authorization. So I don't know about the Pfizer making money thing. They always want to make money, but I don't know if it's just because they want to make money that ivermectin was being pooped on. It's weird that the FDA jumped in. Remember a few months ago we showed that tweet where the FDA said, stop eating horse paste. This characterization of a drug that's taken by humans all around the world every year, it was terrible. And I think the main reason why it spread like wildfire is because people wanted to cling on to what, and I'm quoting, the science was saying. They blindly were following things that just, might not have been true, but were used to ensure the public safetyness, the public good. And that's dangerous, and I'm glad that that's stopped. And I hope that, ivermectin doesn't lose its reputation from this scuffle. There's a study going on in Duke right now, I believe, and they're actually trying to figure out how useful it is in a COVID setting, which is great. It's only taken, 2 years for Duke to do this, but many countries around the world have found that ivermectin was quite good in tackling COVID. So I predict they're going to find some usefulness in this study. All that being said, I think a big part of it was just people wanted to believe that whatever the NIH and the CDC were doing was the absolute best for public health, and they wanted to villainize opposition to produce a better public good. We know now that they were wrong, and I think we're going to learn a lot more about the usefulness of ivermectin in the coming months and year. From D-Money, healthcare systems that have actually fired unvaccinated employees have generally retained 99% of their workforce. However, some may have quit or been fired for other reasons before the actual deadline. Do you consider science communicators a trustworthy source of information? I was surprised to learn it was an actual job title. What would you call yourself, a science communicator? And finally, dear Elizabeth, please don't call us that. Sincerely, menstruating people. Thank you, D-Money, for the comments and the questions. I'm going to tackle the question. Do you consider science communicators a trustworthy source of information? So I think, first of all, like you, I actually didn't know that was a job title. I would consider myself a science communicator because I'm communicating science as well as other things like news. But when I communicate science, I am in fact being a science communicator. Is it a trustworthy source of information? I think like anything, you can have good and bad communicators. I don't think it's good to generalize a profession so much. I think I'm a good communicator, but I feel like maybe every communicator might say that. At least I post my sources, and I hope the others do too. And I hope they are good with engaging in dialogue. So the sign of a bad communicator, in my opinion, is one that will stifle voices or stifle opinions and not debate them in the open forum. So I think that's a critical part to being a good science communicator. One other thing about science communication, there is this thing in science, in the scientific process, in research especially, called research translation. And what research translation is you're translating the findings into practices or policies or further research. And that takes another skill set. You're not necessarily translating research into like another language, although you may. You're mostly translating the ideas into actual producible products or policies. And so that's kind of a science communicator as well, but that's in a more formal setting. Bottom line, I don't think all science communicators are equally good. I think some are better and some are worse. I think the good signs of a scientific communicator are your openness to dialogue and your ability to cite your sources and change your mind when your mind needs changing, according to new data. Thank you for the questions, guys. There were some I didn't get to, and I'll get to them next week, and I'm excited to see all your new questions next week as well, so don't forget to ask. And with that, have a great rest of your weekend. I'll see you guys again on Monday. Enjoy this video.